This is the vertex or crown, and if you look at it, if you look carefully, I don't know if you can see the sights, they're perfectly angled to create a natural pattern for a crown. I'm not going to go into a lot of the details of understanding how to design a crown, but I just want, again, to use this photograph not to teach you how to do hair transplantation in a short time period, but teach you that if you're going to engage in the art of hair restoration, treat it seriously, understand how hair grows. Don't treat it like a stepchild of plastic surgery, because that's oftentimes what happens, and then you get devastatingly bad results. And I really look at this way. You know, you really have only a certain amount of donor hair in the back of your head. You go abuse that donor hair, especially in a young gentleman that may not even benefit from it. We talked about long-term consequence of fat grafting. We have to also understand a long-term consequence of hair. You got a 20-year-old that's losing hair and you want a low hairline, you're going to create this weird-looking thing when they run out of donor hair in 20 years. So be very careful. This is to show you that the angulations for a female are radically different from a male. And I find a lot of people that do hair in women, you know, 30% of my transplants are actually in women, because I cater to women, is that it's actually different. It's a cowlick. There's ideas of a little bit of lateral mounds that come projecting to the sides. The way that the temple angles are actually completely different. They're closed down and they're almost a rounded shape for an ideal female hairline. The sights that I told you about in the male that are low forward angled are the exact opposite in a woman. They're almost angled back and up to the side like a cowlick. And I'll actually design that rotating cowlick in the female. So again, it's not rocket science, but it's dedication. It's dedication to excellence in every level, and understanding all these details makes a huge change. This is an Asian. You can see how you create very fine FUGs in the front end. You cannot see my MUGs on the back side. This is 2 sessions here where with the female with a little hair coloring, and you can see that we've closed the frontal temporal angle down significantly and angled the central areas in a swirling pattern to create that cowlick. This is an example of some corrective work, and you can see there's almost this, I hate to say, pubic quality to the hair on the left, and the reason is due to the graft placers and dissection. A lot of times as surgeons we think, oh my goodness, you know, we're some kind of deity because we do all from a rhinoplasty. Is that in the world of hair, the surgeon is only 30% of the equation. There's a good saying that if you give me the most experienced technician team and the worst surgeon, I'll probably get you a better result than a good surgeon and a bad technician team. And this is a great example of compression of the grafts, almost some degree of pitting, but not too much. And of course the hairline is badly designed and the angles are badly done, so it's a bad outcome all the way around. This is a single session correction, re-angulating the grafts downward and creating a much more density in one round. This is, again, technical error both on the part of the surgeon as well as the technician team. What are the errors? One is the fact the angles are too up. The hairline is way too straight. There is no temporal reconstruction, so it looks almost like a toupee because it's extending out beyond where the temporal area is. And if you understand that a proper frame to the hair must compensate for both. The reason that when we're looking at a toupee that looks fake is because the hairline is so far jutted forward that it doesn't match where the temporal recession is. And it's not just the fact that the ways of the angles are off, because nowadays with hair systems that are woven, they're very natural in appearance. Oftentimes the best thing for those people that wear a system is just to rebuild the temples, and you get balance. And obviously you can see as well some pitting. There's actually these little clumps. And the trick is when the technician is placing the grafts, they need to be placed about a little less than a millimeter above the surface of the surrounding skin so that they recess back into it. If you place them flush or slightly low, you're going to get this pitting effect. Again, a natural hairline, as you see. This is, again, terrible angulations. This is probably mostly the part of the surgeon's fault. Bad hairline design, angles that are straight up. You can see the insertion points of the grafts. And this is softening the hairline, bringing the angles significantly lower, using much smaller grafts, and bringing it back into a much more natural state. This is just a one-session transplant that encompasses everything but the crown. Conclusions is that if you're going to do MUGs, to do it with care and to do it with after at least watching some surgeons doing it and using care and understanding the good selection of a good patient candidate for this. And I think that MUGs add another paintbrush, if you will. You have more things that artistically you can use to create a good result. as a small promotion for a course I'm doing in November in St. Louis. What's great about this is it's all hands-on, because a lot of times when I first started making sites, I didn't know when my sites were bad, and until someone was able to watch me. And so I'm going to actually watch you make your sites. And finally, it's a merger of technicians and surgeons. So very proud of this course coming up in November. Thank you very much for your time.